Samupe, Sampa Dietia, Chimafidi non kotu, era one radio. Samupe, Jumpa Dietia, Chimafidi non kotu, era one radio. Oh, and you pampuma, Asam pampuma.
And viewers all over the world. I think it's been a while since we met here. Of course, you know, it's summer and, you know, vacations and stuff happening. So tonight we're coming live to your homes, to your vehicles, to your kitchens, wherever you are. As long as you continue to Facebook and YouTube or Modern Ghana Radio, you can catch us live. The number to reach us is 2402-802-633. And in case you want to text, it's 510-931-0946. Tonight, we are looking at another health issue, health concern. We want to throw the searchlight. We want to focus on the motherland, Ghana. Looks as if the HIV incidences and prevalences are increasing. So we want to throw a little light on it to, you know, enlighten our people. So we're talking about HIV, the challenges and resolutions in Ghana. Who else to help us do the discussion? But the Honorable Pastor, the Dr. Opoku Agyemang, he's in the studio to help us do that. Nti enyimre tie for manya bre adagema mobeka ye honom enyimre broadcast so na mimi ne bia ye no era one radio ye health is wealth wa pomodin ye wa honya ene ye enyimre nti enyimre ye beka yare be efe no mo amuni efe no HIV. Sometimes I am confused HIV ni AIDS ye be cheche mo kakra nti ye hwe challenges niema sunsanso ana say some edi ekira edeba HIV so wunya bia then na ye ana say then pon ede ne ba nti me yenya Dr. Penny kese wa ha ya doctor then Dr. Opoku Agyemang or your sofo nti onim nyame min nsam no edu ba bia say bompa ma be bompa ma na edu ba bia say ye church we na me say wan kasa so ye na do bo ho ban so a ye be church nti enyimre as I said earlier on, we broadcast live on Facebook, YouTube and Modern Ghana Radio. We are discussing HIV, the challenges and resolutions in Ghana. All right, so I'll do a little intro and then, but before I do, Dr. Ernest, you are very, very welcome. How are you doing?
Papa, Dr. Boison, I'm saying, and there will be a man here to say, as a Rebecca, is as a hint, young country, you project, am I gonna volunteer? It is so, the Babu Modia said, there's more scientific and the Babu Modia said, the battery no be at TSA.
Okay, all right. The apologies a bit through her and say, I am more abroad for now. More pay brofu pie ne bia na nyimbe ye ntumi ye no brofu pie nyimbe pe se ye educate ye Ghana for ntia mo fanche se brofu ni pie be ma mo fanche ntia nyimbe ye be hwe the epidemiology prevention so medication bi o ho a ye betumi a prescribe em ne be se kan se obi oni fe bibia fa this can say abrofu some custom ye fe bibia fa disclaimer ye no ye nye medical doctors ye book doctors ye kusua woman public health na ntia ye nye doctors say who do yare by diagnose and that's the disclaimer. Yeah, we pay proper adequate diagnosis and patch book appointment with medical doctor and also provider. Na lab test BSC you know because HIV no will be an obit me actually when him I catch us HIV. Although be sometimes and symptoms be where doctor be our coordinate to me sure when man or share symptoms be also way but you know if you just the intuition we can just HIV in Tinsrawa no one who doctor. All right, to mean kind SF kakrebi ni yankoso. Yeah, since I kasaba Ghana, say a total of 23,495 people in Ghana tested positive for HIV in the first half of this year. That is January to June. The figure is 2% of 948,094 people who undertook HIV testing from January to June of 2022. Senior program director of National STI and HN. And this challenge is via Boison means there are numerous effective and evidence-based prevention measures against the spread of HIV. But the biggest challenges lie in the lack of political commitment, reluctance to address issues of sexuality and reproduction, and criminalization of key populations that are at risk for high HIV. Nti no person nchen say problems ana say near kun to kwa pii ni say prepi ni pii fi aban esa aban oye ohihye odin hihye tutu a ebetumi ama enkofo engo to bi say prostitution ye kan Ghana for more term fe na shawo enkofo mo kokko jinjan kwa ho sese bra wo pese me no kofia na sa na menya de yare pi banti ye behwe ho asem na yaka ye beka ne kakra na excess bi a me kan fi rule bi or research ye fe no DK amofa so doc ba ma kan excess kakra bi an bi a ye benya apọ kakra fi ona ye de asos so more and more Ghanaians no longer deny or are indifferent to the AIDS epidemic as they witness the increase in AIDS cases. The first reported AIDS case in Ghana was in March of 1986, and by the end of 96, the number of AIDS cases had already increased to 26. Between 1986 and 87, the increase was 35%, but in 1988, the increase was 600%. There was a fall in AIDS cases between 1990 and 91, that is 1,011 to 903. But health officials believe that the 1991 number is low due to underdiagnosis and underreporting. The total number of AIDS cases is 3,140. Almost 75% of the cases acquired HIV from outside Ghana, which means most of them were female prostitutes. The female-to-male ratio is 4:1 compared with 1:1 in other African countries. HIV prevalence rate among prostitutes in Accra is 2.5%. 4.6% among patients of a sexually transmitted disease clinic, and 0.5 to 1.5% among blood donors. Cause a problem. The Ghanaian AIDS Advisory Committee, created in 1995, counsels the government on how to prevent HIV transmission. The 1989 medium-term plan supports creation of HIV surveillance systems, information, education, and communication, efforts testing of the blood supply, psychosocial support programs for HIV-infected people, and adequate clinical management of HIV cases. Regional and district AIDS committees are in charge of implementing the plan. The National Advisory Council on AIDS guides AIDS policy development. HIV or AIDS control activities are integrated into the existing primary health care system. Some obstacles to HIV or AIDS control efforts are inadequate funding, including donor agencies not honoring their pledges and inappropriate allocation of the funds by the unstable government, insufficient supply of reagents to screen blood, and some hospitals still using unscreened blood. That's dangerous. The greatest obstacle is long-held socio-cultural beliefs, attitudes, and practices in Ghana. For example, even though 80% of the people know how HIV is transmitted, most people still practice risky sex behavior. Many people equate a condom with infidelity, so condom use is low. Into any researcher, Jika Mofa or on AIDS in Ghana, the profile, strategies, and challenges. This is just an estimate. Doc, Major Hammer, now what was now what boy over to you.
Yeah, I mean, before you continue with the information Dr. Boison and Agyemang, we share world population so here there. And again, I think that there here as your TSS, you have HIV and you have AIDS.
Okay.
But HIV ultimately due to AIDS. And then you know, as I see you so here that HIV and AIDS. Your case when your HIV infection, and like I said, and one be about you know. The case when your AIDS and like I said, one exhibit sign. On better one exhibit sign be said. And my editorial unipeduano. Like I said, when your HIV stroke AIDS, and she's all my immunization on Sokaka. So share the whole world. It's as Africa, yen share the data no collected yearly, and it's a yen quality data yintino. Very, very strange to get the actual information of AIDS in almost all the countries in Africa. But I will share 2016 and the latest data in 2016 data in and say the whole of the world, there were about 37 million HIV cases. Now, out of the 37 million HIV cases, no, Ghana, as of 2018, no, there were average of 310,000 cases. Out of the 310,000 cases, no, a man no money HIV 200,000, and a man so no money HIV 100,000. It is out here the remaining 10,000 way ebia enkwala na omunso anya ACB. And that's many HIV ni limit HIV ni bi. Enti HIV ade bia endemic e Ghana. Yeka endemic a yare a eti oman mu a edi enya kakra ewura nipa mu. But yenka ne ade ba ko a HIV eye ade a emu asem ka aye din nti aye very challenging ni say ade bia kukuo mu yare. Eye yare e wo honam nani. Ena nipa ne hu yare bia anase ye mo bia omo infective wi anase unye wi a wonim entino onso betimi de akomo obi foforo e wo nem anase enima bia bebu bodin a kire mo sisi a no eni se wo hwe HIV nankasa eye ye kase ye behavioral disease eye suban yare eye suban se ne trimu no yare eye suban ye kase yare eye suban ye se usuban bia wo ntino wutimi de yare no tre se ni se hu me pemadu enti usuban ye ma pe no ebe ma watima akwa konya yare ni bi na agahosem se ukonya na so aware a wodi be ma oyire so hu enti no nanka data ye me pe free Ghana honum no enye data no na Ghana for present mai ese Ghana for tinchiche data no mi ehunu se data no ebia enkwara omanya mfie du ambilu womo yare ndodo se ne wo ho womo nya free ha womo omanya bia 10 to 15 yare ne bi womo omunya free ha na atoto aso akopem se ibi ebedu be 65 and above no eno de ebeboa any epidemiologist bia or hwe yare ne tima determine se ade we group we no mo yare ni ntino ye hwe ekwan ya group no efa so a enti oma yare no tre but data no ntimi mayen information bia etisa ne aka nse o se data 0 to 15 16 and above enti no ntimi enhu a confounding factor shin bi ono ma ema ebidie course no ebidie ba form no enti no ya another question yes Ghana for no prepare data and some more answer more classify details ni so the be bit me who data no information I provide mine na ye ka bibia fa ho yetima aka fa ho ye again ona omo ka bibi say between 2000 and 2015 yare no aba form by 57%. I think that the goal is 80%. In the 57%, say we have not gone far. We still have about 23% to go. And it's as I say a year mortality rate reduced by 33%. And so and too much. And yet too much say mortality rate should come as low as 10% and as even 1% on that particular disease na yaka ho asem. Enti no see hwe yare no na fe say Ghana so yenim say basically heterosexual transmission. So yes, heterosexual transmission there and in education to go to both sexes. Enti no kwan be so na ye betime fa so amasa education. Dr. Boison can be say funding the idea here kese pa yi wo ka funding say wo na wo yare na so ba ko make ha make say wo na wo yare ana obi pese wo beboa wo enti wo na wo yare no de ben steps ana wan kasa wo fa wo de be bon ho ban say wo yare sa nya yare ni bi eno ne ade a ye be ka ho asem kese pa yi ena yebeto aso so achichi mu bisa ye ho kwan ben so ena yare no etre sare o sikatro ye doctors ye hwe book mu ye hwe data mu de mai na ye bubu data nu ya kekesisi ani na ya kire se ade we ena ede yare no ba kwan a ye bitimi afa so abo ho ban nie and intino some fashion no more as an individual no and anchor no and as a community no and as a government and as a department no a be fashion the victim ebi ayeduma and intino ye kasa yi mu no ade a pese muhunu kase pa no yeah na Dr. Boison kasa no can be said the ratio of female ratio for HIV na 4:1 in other sense no you bet me aka say based on the information no a man no manya yare no pa se man no manya yare na you be push am say ehinifa na yare no free by o mention be say according to research we are here no foreign women on the yare no back room no enti no say foreign women na the yare no back room no there and what is the government doing about foreign women na omo back country home enti no ye be try say ye be best suggest na ma bibri e dey amamu be before ye be go so suggest na amamu no me be say mo ma yitwa ye ni ehwe ade bi e wo HIV senior the symptoms about what we be hunu say we ye be ma na say emwani bi ba reading mu a tomre bi a now and now this say when you are bi a utimi ohutimi we ye chill a wotimi do a tomre bi a na wa ye mre utimi nya fever and as ho ye hye na ekuro abeba wanum afi na utimi hu say wo nipadua no mu emu ye wo yan kakra tomre bi a na anadwo da na say fifiri bi te wo like I said, usually no we need symptoms here can now but emra mo na ba reading mu no symptoms are and I say adia about reading mu hu ebi na mabobodi no ebi ana ensa bi agu usrem ana say won sa ho ene ba bi sa no eye usual na ohun say abegu no na ebi a kwatrema so enso aye kuro bi sa afi na when we say what say when corn you free be length bi ho na so ahun enti sa enema ya mabobodi no kire wo say emwa ni bi abetrem however no at this point in time no nyanya AC we say AC no a little bit extreme and enti na extreme na afi we nipa dua na hase ewiwe so abre no na wo yanya AC and ewiwe so a wait be form and never be ebe dia bini wo nipadua no enti na no aye ade ba ko a wo ye be ma esese wona atome bia ya na de makekens bia na emma no bi won so na ebikisi wo abrabo enti no emma no in addition to the bisi abrabo mu ebi ni say wo menstrual cycle be a little bit interrupted tome bia na ese wonya menstrual every month bia na be wo so le be mi sakra na wonya na fi so ubenya menstrual period na very heavy to me be very heavy to me be very light and you know say who say we obi a we sexually prominent wo wasitiremu na unya a sign say ya as a bomodin akọ hospital na omotimi test o ma a bit mema wanya we yafun no say yafun ye chemu nan a utwemu enan na ba bia ofuma no na se no yafun the lower abdomen na ehon so hase etutu ebetutu ana afi won kasa na ewo usisi honom no eno so eye oya atomre bi nso a ave free woko no se unye hu san bia woni obi eye eda esanse mra first na woda na unya pin this time obi obi da obi se pin bi ahase eba ewo wase honom na the chat work around say afi we say fungal bi ahase wase a friend yeast na omo ahase form ewo wase honom we nu na no na unya so nko test ni mu se wanya HIV a unya kwa se yare na ebe inserting se na be building itself up na afi lead to HIV no AIDS no enti no sa ne ma mi na mpese ye no so sa science no betimenya emra wo HIV nko na unya nya AIDS no again no ebi so betima atro omunya science bi kura ha enso na omo HIV no ewu mu Omo sexually active no omo some na make him because na sexually active na that could be na utu kem na hu about bia no fefe bi gina ekwa no we are what so we the mama fa no na me
Pemenum.
Ukọ ya na ade we abepf no enti no the make person me see as bia na Dr. Boison so we bi kakra be ka afa
Yo doc that's one my feel up near me person make can say doc amaye eyi one my symptoms ni p near me so them say wo hu a ebetumi indicate be kire say wenya bi cause yare wo wi ase the dawson but the HIV no one of yare virus na cause into more money difference between HIV and AIDS no yare na ma AIDS no AIDS ni human immunovirus eno na mboa no no munyia no mo duplicate mo wo mo na efi akonya acquired immune deficiency syndrome eno na ma immune system na efi ay weak kaka ntina do kan no na we funtumi ya we tumi si na wo anka wa wugina wo na so na efi why weak ntina chese du ho na chese wenya saa yare na a weakened immune system. The only problem is say causes no kind no and yen nya ye obi a me person make about stigmatization yare ni bi wo ho a ye fena doc kan no bi wa na wo kushi abaye bi we Article Junction na se Paloma Junction wato fried rice aman so Ghana so dey say come dey na wonyo bi mo to fried mouse say dia obeka so sister en kofi a sabi bia na obedi wechi wa man fried rice dey dia obeko nti no etumi causes sa yare no but the problem is say bi mo ho so a enye bibi say wa fa sabi a hya wo na koda na wonya yare no obi wo ha oko hospital so yeso ne hemoglobin low nti yema ne moja na fi obi a watwe moja da bi ofise bi a oya adoye wakotwe ne moja no omo antumi sna me kan earlier abstract no otwe moja no omo antumi an test moja no because me adwuma me ye no me ko inspection me ko hospital sa ye hwe say okay moja na wo be manipa no ya testing nyina ma yare bi anim nti no hospital na wo yes na facility wo yes na so when to test na so we dey me ma o ticket ma buy ni wudi nti bia na antumi screen moja ne ye na innocent persons yes doctor say man moja no ne ama ne moja no na afi okonya yare bi onipa sa no enye ne mfom so ana so wane wankutwa ne ho ana so wane obi anda but because of that nti so say okotwa ne ho so wantwa ne ho so nya ne from a different year omunya ne kasa den omunya yare bi nti wonam ho a Ghana be kasa wenya ace ya tisi wenya bi ko bia uba na ya twon ho asa Israel days no wenya kwata na ya tisi wenya kwata uba na obi adwane nti there's a young person make about stigmatization say yes stigmatizing kofo so obi no wenya yare ne bi but bi anya ne mfom so nti no sa no how do we even treat the person because bibia e wo kro no mu wo wankobo adwama na so wanko bibi but wonya bi nti unam ho bi because sister no ko wonya bi o na bi so ananya ne mfom so nti doc ahosa no how do we differentiate how do we educate people to at least decipher between obi a wakobo ne Paloma adwama na obi so no say na me kai no through no fault of theirs na wonya bibi sa na how do we treat such a situation?
Yeah, me that's doc. Question answer no ano but see ya. What can a way one way transmission will take place. Another way I ban say akorabi wa na mama no enyim no na mama no obi.
Okay.
Anything no owo akora no transmit to the child. The akora no oye innocent and was abenya yare no. It was also noted in some place in some of the research I might say akora so wo na say wo mama no wo dosage of the virus in dose no it me equal through the breast milk akora no so timi infection. And you know yeah dey bia e ho asem kan everything kakra but omo bia prophylaxis bia omo dia ba ye be kan was and that will help that one to a bit me reduce omo yare na ye kan ho asem. Another way be na person doc you hwe ni say e kwan be so na ye kase nipa nanya AIDS from HIV. Now answer na ubenya AIDS from HIV no I just say HIV no undermine immune system no
Okay.
Our immune system no are so low, sir. We are susceptible to different kinds of illnesses. At that point in time, let's just say we enter into the AIDS system. We are AIDS patient, HIV/AIDS patient, and that is another way. So I'm betting me like the old kind, blood transfusion, and apart from metrosexual, vagina and penis intervention. Another way is anus and anus and penis intervention. Almost it me in HIV equally. And yasha a choir more fast or HIV near whom choir fast or munya is. I feel like as a epidemiologist, no be more of to say. Since when you is the quantas never vessel above. Now, first part now kind of transmission. So when you read there, the only way I'm being said they have to reduce the load, viral load, until a certain time, load no be insignificant to be transmitted to another person. I think it's as a young person, a baby do be a dinner ubi, a to be an intino. When person about do be a dinner, but your prophylaxis there, your mom nipa no nom daily. Ya test on positive crime load no too high. Your mom prophylaxis there, nom daily. Not the more now, woman so man to mudia. On benuma to a certain point, viral load no be very, very low. Now, yet transmittable to any other person anymore. And that is answer to a question and not Ubisha here. And I'm say I did be all no doc. The person can ye pa. Once I work we are specialists or lab working pa. And HIV so I think the only way I bet me a detect lab work. And me susi yemono. A country like Ghana, in order for us to cut the cost down, Doc, what can you say? Senka, Omoma, Ubia, or Ghana, employment, Bia, be making Ghana Biano, come make it free physicals. I'll be a lab tester. I got intimate one moment to me and determine many diseases, including HIV.
And a because even we Ghana, so when a make visa, a green card, cry now over back from her. Your mommy cousin is a sad time where son I was me bobo doctors for dinner, but now, me time in India, I think saying your clinical said never quite no quite say whole blood profile near herself. Uni Arabia would be too come back for. It's very important. And most of the employments, companies, so before I ever have Emma we a lab test, making sure so we need chronic disease because especially it has to do with insurance. And insurance for no we be Agyemang no who say we need chronic disease that we be making claims be company neka because we thank God so Obama buy and introduce Obama care no can be to say what was it what is the word problems in say men fa we are what that no and fan be say so was I na solve answer but at least thank God and also when to question very important me sure most of the companies require and even as citizens nankasa you don't even have to sit there and wait for the company. That's why we have the annual checkups. They do time be even call shots or vaccination in o koko who doctor now shots say amount no much me through that can come to me lab about certain age econo adding your much me determine to say yeah cost we no and say penny years every year be an went to every 5 years be up because soon maybe I will call it and I can just be a kucha who kwanda unya you and I know saying yet shaking of hands doesn't necessarily give you HIV. It has to go through some orifices into case name service this time I can't say but remember so a very huge problem. The companies have to your question they have to do it and that also leads us to discuss the issue of LBGTR CCI prominent organ very important. I mean, nobody is going to say, you better prevent it from whom you want to fall in love with. But from research, Sir, a way of having intercourse no has also been a very serious cause of HIV. Intensity is very important. Into moving from your question, maybe we can also touch about political influence. What can the government do apart from funding? You can't prevent people from who they want to fall in love with, but can the government do something to prevent men trying to sleep with men, women? Because men to men, they're a very serious case. I don't know whether it's something that we can address. Because I know somebody like a MP Sam George or as in go somewhere there, or a very prominent advocate on that. On the person Betty word nekra. And well, some people will say, so, in my own life, me and person living life, what are you going to do? But it's an area that is very important. See, on this platform, it was a sound to say, if you can avoid it, please, sir, a mail to me, a very huge problem. And Mr. Doc, I come back to lab now and I say, Yamfa, what area was? I mean, if I say any pre discussion, whichever way you want to go, that's fine.
Okay, young tree, you can see a use now. I'm sorry, a bit pop in home. Not person, you share a deal back on say, a quite best crown HIV in a tree. Once a what can't be me. What can a route transmission? I mean, me come from now with the LGBT in to whatever in to whatever no about Bishimon. Now let's look at another sport to be said. I was inner sex, as you are saying, is one of the prominent. In fact, it's the first thing that has been mentioned in all the research that I looked into it. And inner sex, one, I think they're gonna for the more law say it is not going to be accepted in the country. Okay. And people will be persecuted if they found out going into that. The Ghana, their law, but again, the law does not necessarily mean say woman yet. Unless otherwise, there's a people who will enforce the law. If the law is made and it's not enforced, it has no impact on the country. And I know you have one aspect of it. And the second part, no, so sharing of needles.
Okay, that's true.
So sharing of needles and syringes from previously infected person. I don't know you see now blood woman and also no nipa no edeko issue and also obitimi enya infection. So and I say needle be ya dia wo HIV ni bi nsa no fancy what them hospital they clean the hoya na hospital be omtin the needle back see ahuru mu na omasa dey from wajuma. So and also can be a source of infection.
Yeah, how my main can be being source of Mr. Ghana for no. Your doyo Ghana for dom pa ye did you asanka bakum. I mean, even we susan sa treba kwa we atre no the asamu no we susaje no the same atina samu se sapone de bedware a we di sapo okudware ye sutao bibia ye share. Inti se e ba na de share nfa enye problem. We are a nation who like to share. Whether it's good or bad, no, we like sharing. And it's a needle issue, very especially if you hear drugs, a needle back or the one or say, oh, Kwame, also J. On dreams, me do, me person protect you. But because me power 70, me person share, be and share. Sharing be a sharing bonnie. We have to desist from that. Power down for us, yen boom. Ye bibia bom ikote mango kra we soke kakra na sa no na ni asasa soke ye ndwi bibia sa de we yare beba nyame na hwe nipa so because sapo ba ko ne tawo ba ko ne ade de dware wo Ghana de dos na se be pie ha enti bibia enti sharing problem de a very say hwe sharing no in fact de bibia o say wo do bia say wo hu so okay me no we share but adna ye share no yare tumbem even siblings from the same family crown still it's possible say you can transmit disease into a very, very crucial and issue now bring it up in a very important for we share needles near the please if you can desist whether it is drug whatever is in a hospitals or recycle say chrome advanced countries nobody recycles the same needle you cry even who baby I'm quite inspection they say donate blood po na say your friend say venipunctures and say phlebotomist no or stay kill. Now say when you flash when you they can't even use the same inankasa now no start where money you see the same needle be so touching completely the whole bag needle be or touching no some could be boss for you for pro. Can you imagine other countries? Oh, Jack, I saw where the young men and pushing some chamber. And no one so much touching homo discarded, no covered new one. Inti advice to our people, in fact, I mean technology by a near be Sunny man yes be and share no and you're very healthy. You see the same, you know, and you're fine. Even because those describing make holy communion quite sacrano. Cup back in you so you soften it a tower kata or papa when they are no more. But coming back to our question, no, there's no more there. We want to cite a form of warning. It's not safe. More drugs now. More question get to where now with the our way, no way, you know, you are more transmit because you so we share no question with muna. Moja kakrebe ba out no. You have no idea how many bacteria or how many viruses are coming out of it. Just a small drop of blood, no. You have no idea. So we call lab microbiology. Now even small blood drop of blood, you the two petri dishes so near culture 24 hours. Organisms a bit grown, no, you'll be shocked. So we just say we call public toilet to cry now so crap or we show because we'll be at nas and one paper also quite national. Organisms are what picking from that they're dangerous. Internet so clean up. Sharing of needles is very dangerous. Please, if you cannot stop sharing needles whilst doing drugs or whatever it is, because the hospitals and they are not even allowed to use the same needle syringe because you say wuska, but eventually you lose life, which is better. Ube discarding needles and also ube cycle needles not in anyway, doctor also.
Okay. That also mean no back once I'm here. Once HIV 9 casano you once it was heterosexual. A maybe a been oral sex and son or be homosexual. See men now a piabano. Most of the time I am not virus and a vaginal fluid and also virus. In essence, no, so being HIV fluid be a fluid who baby no a questionable. And say fluid be fluid being one other kind. I say or more you be or Ghana or more tires or but them I know she get no pen and kuchan who that was your canon the Mujafra said the Bayam Bidimuja or your friend Mujafra or Bana you didn't feed them and the Bema you didn't feed them.
When you some more knowledge as someone you because knowledge is ignorance. Anyway, sister Abraham from Paul Chian or some assemble.
You know, and nona Emma HIV intimate free money moon. Sunny my abu din. And you know, until sir doc can be ever funding. I'm sir, you bet my committee primarily from the local level. Yeah, my name is local level. No, mubetimi I establish educational centers. Ewo nkron getting in na more for teachers, no more training teachers. I want and as a more for students now, my school no be. Na more training woman na more HIV prevention education. Na omotima ko kano nkran ase one and communities are big cities because big city there is made up of small communities. This is education no the ma was small communities, you know, big cities, new rural areas now. A lot of questions may be asked. Oh, when the people want to do something, they ask more questions. And when they ask more questions, now which and we have the mind to explain everything to them. And none of that they need to understand the disease itself. Or so much yariano assay. So much yariano send me any suban esitie. So much yariano a quanya yariano faso etre. So much yarian or much yariana say a quanya obefa home abon. Say ya unya sa yaridi. And this more combining these four factors and that will be called now they call children a lower cost than say mode van and now mode be cook or baby number boka bibre. That is the lower plan I'm meeting at the amount because now prof no can found them. Yeah, look at na bit na receive funding. So more money some more yare no move. So my men the be yare when ya is ni bi no. And now papa bi the be yare when ya is ni bi. And now buffer fe bi a watete no be ya is ni bi. When ya catch us say your ma is education. You have to go there. I say ko na ukoko tie bi. Na ukotia e be boa. We say HIV akwa onipa ninya ebetuma tenu mu many years and sana dan ho di. So from the historical evidence ayenye free HIV yare no say ebetuma stay home, but the most important thing is so when HIV we are infected with HIV na when you develop AIDS no na something na what you ni no so we are sexually active the more now we know be and the more now we distribute to yare no until it makes the society or the whole society at risk. So one way unko waiting the money per 5,000 krumo. But don't forget say what the money per ba no kwa ono bi anu ama ho bi no ko bi fufuro. Until now they are coming nipa fufuro. Na nipa fufuro no so ama we no so they are coming nipa fufuro. Until as the network express no one we are promoting the near time no na o the arena ama obi wo promoting na. Until very important say obahwe hu ye na wabon ho by etia HIV ni say obenya infection. Until also doc person okasa bi wo kan na
na me person me bisa say me share dan kan too much about them person me bisa say prostitution, which we know say one of the areas that lead to transmission of the disease. Ghana near laws are preventing prostitution now, because I know sometimes police phone echo around or but is there a legal law enshrined in the constitution now say is so more as I do bibi sa
I think that to the best of my knowledge, you know, me say bibi sa but what I read some time ago is your more license one to me practicing the more practicing. But again, on the HIV team no provide you condom one more issue. But I mean Prof what di madance Bema o free baby ba na ni abre o ba be ya de o di condom no kwa room ya. So
yes and they oba na said it. When the ban say we gina ground say kesa masa won share de ndi actually no way o. But omunya no so omunya do na sorry nti obi amai.
What omi eni na aya arousal omo man na on so pensika na age nti no on fa ho so for ba obeba no ne benya yare na ko. But I'm say sometimes when I was there no na yes surprise with condoms. Na yes surprise more condoms are ombe use a anka omde be bo omo ho ban na afi omde abo community ho ban. But again and again no that is why I may classify HIV as human behavior, a behavioral disease. Any pan behavior no onye unsubscribe to rules na wo ho. Enti de obumuna say na wakonya na odete ho no. Na nka obi ba no be. But I think say the next step na me person bia me no you discussing na it can recommend it to the country and say nkofo bi ti say wo mo a omo aye sa Agyemang abo di no say friend say
LBGT bonana. I shall upon Nana.
Me say your member shall win your marshal.
Yeah, and by most of the if you say man kwan ya shawo, but be ma also kotwa ho pe so ya shawo. And now we
I shall win be. It the member be me say. And I said if you say a very collective minds are even a bit not taking see answer. As I said one more teacher no so one more physicals.
Okay.
So one more physical maybe a almost say we were calling there 5 years and kayama one month so be a one month ko be a yearly be an omnia physicals. Obi a we shall be our Ghana no na person will continue with the job now. And every year be an physicals. Now you who say we are physically matured, physically decent, and physically clear. So we to me perform our duties no. Emra my source of infection. Emma the community now or provide services to them. In the another encounter, say all the epidemiologists in Ghana, including the medical doctors, health officers, will agree with me. And can me make sure she said, South physicals now, yes, suggest all workers in Gonkoyeno. And can me feel say, one most people could be a beboa. And again, no, now we funding. Say, okay, physicals, this is blood physicals, urine physicals. We hear chemistry, chemical subjects be out of the account. Indeed, those are the funding. A government no provided to all the institutions. No, nothing almost 80 the perform duties. Now, yet me Nyabia kitten be a shisha nipa no one. Edokotoku womu fee in one. omunye huniye na boy na yetimi nya data on it and what if it is preventable na yetimi a prevent wo.
True, because I was Agyemang now person would make you sick at their income there, and every year be so yeah, because I had most of Agyemang here federal you say HIV in year requires so in every year. I mean I think every other year or so, and I say when your doctor recommends in BBR. So what testing negative for so many years and year requires so in every year. But to be what's our profession and say you need any legal laws restricting against you there. I mean, you are harming people. And all kind sometimes we really fit so share protection, you know. And even Rob and the crowd, I mean, say they be 99.9% safe. You never know. Be the near broker will be you never know. But on that, maybe that's our question. With me share movie be as a Love and Basketball. I mean, it was really a nice movie. I think one of the actresses was Sana. And the main funny here, Love and HIV. Penis and warrior, they are so much head over heels. So on person be TBB cry. And BB to say medical, your spouses or your fiance's medical report in it. And necessary say, as I say, each of you know the partner's HIV status before they get into marriage. And because you're you're chronic, but and means how and you live with it by yourself. But BB say HIV, since you're going to get married. And marital in a bring side, is it as a form of need? Because we have obviously on country. I know we've all seen video stories about maybe I know would be well which Masusa when you be able to come the final wife and maybe one country so is success. And a necessary say who or ban and as Obama who demand the say the partner one who HIV status answer now. Mark yes I do now.
Yeah, I think like what we are saying, it's also a matter of agreement. So, we are talking about physicals for any job in the country. So the better beating me determine certain diseases there. Yankoya lab test and we can find it. And then you also want to transit for the rest of your life. And you don't want the person to harbor something. At the end of the day, a very resurface now for your problem. Because I know the being infected now, so the ideal thing is recently when we say marriage baby, yes, I did. So the overcall acquire psychosocial analysis. Now here will psycho level. Obetima here blood level, blood chemistry level. But I knew being a man who sickle cell in manema and the thalassemia in manema. And some which could determine say by compatibility in between me very flexible. So I compass and I say we are sickle cell anemia, mention me a sickle cell anemia, your man on a problem. So
problem, yeah.
It's highly recommended. Says for sickle cell a very significant yeah. What about HIV? And so you between the account here. I totally agree with what you're saying.
Yeah, because na me wa down for be in your UST take sister no we I mean in her I think in her I wouldn't whether in her late 40s unse sickle cell phones normally as Ghanaian name say so umunyi I mean so we carrier maybe you have chances but we positive there I mean so we SS whatever it is not it's likely say I mean about two or lady na me onya pa 40s are getting the 50s no be so nothing going to happen but now when the family move eventually owuja nukuno and some of these things I don't know whether they found out via nukuno panel young tests because so I said both of your careers are along the line one of them will become infected so it's very important although we fall in love and we can say hey which one do you prefer I love you let's check this thing before we get married. Rebecca so me do so much into me no be wabom who will be woni bi o yen kwatan na wumbom ne enko but later once no we jankola ho am so on be suffer and it's very imperative say at least ye me ani I mean odon wo ho but do the needful if it's necessary say I mean so no business say okay I can say hey Jack before me wire no and I before me wire no me wo masi aka yim tennis on the pakono pewa obetumi aka case in point this basketball player Magic Johnson I mean so obianim say he slaved with it but because of obeka se kakra won hunti in drone prophylaxis in also why the guy is still alive. Oh, people say yes, first in Konya a year HIV and AIDS. Watch 5 years, 10 years now. I mean, I think it's in the 60s or thereabout. He's still alive, so there is medication to counteract it. But if you also can use wisdom, please let's try. Yen nyina ye do ye ho yen ye kwa so Rebecca so ye bebo mpaye manako mpa ni hia but do baby we have to apply wisdom apply answer so I didn't know what you it's likely so what are the chances menya bi it's very important say ye benya bi yen take doc akasa for a while me man 2 minutes 1 second yeah 1 second yes be 10 seconds be don't take a break in num show na bi mema acrobotom me message na at one share baby am Ghana no so bia unya hospital bia nko me test wa kona acrobat kasa no becho baby obetumi akoma then hospital betumi akoma ya bo fanya na
businessman at the same time so me sanso ye actor nyeka mpo ena makwara sabia ekosi se dakro me ni me business for ahia ye meeting prekope me call off me wurhwi bio me no te me no na me obanahin specialist hospital wow emfidie ni machine sha hodo na mu say yes hospital ebidi de biachi
me hu se mayo kakra nanka mensa contract bi eneya agibia ena problem e bai di kan buti mama akwahwekura da masamba ka me ni beje ho pa
oh men worry e person we treatment no and so your facility wa ha be boa na new business partners na ye meeting e da mo ase and hospital kwa na mo yi awon na ye zuma me ni mo ka say
o peto ko hospital ya me kanfo bana hin special hospital ma ko they are ready help you. Baba.
Yeah, doc, me that say. Yeah, call quite the first one. You be prevent HIV.
Okay.
Somebody can be we have touched the preventive aspect of it. But now I still want to go back to what some kind say. I was say you're speaking about the annual physicals. So it is the only way you bet me the screening those who have it and those who do not have it. The simple reason why annual physical here say, I know the say government no force. So it's one of the dealer or the being employment. And I say warrior, the one of the dealer obey ya with me say ubi yes so be a thalassa be we thalassa when you thalassimus ubi your friends TV ubi need TV you bet me no classification no some combination some warrior no we bet me warrior effectively ya be any mummy in time then munkola be wo na be very useful children in the society. The toss be on say okay screen be wo me ehunu yare ahudo bebre won ho yare bi why preventive no you can get education e bi so you treatable they will give a treatment for it there and so wo ha chronic yen hwe yen so e bi you be advised on that. I strongly recommend again and again sir physicals should be a very important thing and the government should put it in place so that almost everybody in the country who is going for any job, marriage, or anything that is related to job should go through it. Now, the Tosomiansa, political. It appears that in Ghana, Adibia, your politics. But this is something that the person Ghana for in United as you said, we need to be under your politics. We need to be under your politics. So, we need to be your politics.
That's true.
We need to be more by and and a do time be on the this is to the parliamentarians. Yes, so the parliament, Mr. When more discussing be a national issue, and Miss Ram Tomobo, Namon politicians are there. Sir MPP, say NDC, and the bank implementers are there. We make sure say a national cake. The piano will be a Bahubian on a government and could continue it. But when your mother say they come up party when they buy into me, Bamin can when they buy into me, Bamin Yahweh. Or anything that is related to the health of the country, yes, some get together, work together, come out with a good resolution in order to finally, work on it and either control it, prevent it, or eradicate it. Some way inside there, man your health hospitals are because it appears or maybe MCC hospital be and not just a yare. You don't want yare to come. You can prevent them and save the scanner of this hospital the BCC baby. Hospital baby on average of 100 people in a call a day, which is not useful. So Abraham Kamoko preventive services be on man kayare area on meet my catching it down. Now I must see help push it to be a one. I strongly suggest Mama you the physical aspects very well. When discuss no parliament, no money side in to no now omitting quality data, new the national data. Country be a survival be like United States near the plane. The country's data on the boy moment survival. Now yentiminya data, a boy na yetima analyzing who the problem in the country, yetimi abwa. Physicals is one way to get it. So the political people know maximum catch them out. Dear yes, a catch them. Now the toss be on you are looking at the foundings. Found the Beboa in Crassifo. Chrome, any workers are or more a young man. Quite a person meeting me aquarium fiscals. Found the quite a person meeting us support two hospital labs. Na almost what my young Mojuma, na effective. Afe, ye nimsa what the maybe to say condoms. Maybe now what the condoms supply. One more year. Helpers na omo krum na omo ajetu so mbeye ashawo adwuma no yesema mo ne ashawo fo no enkyerkyere omo we fere bi anim mo kyerkyere ashawo fo no kwan mfa so a ometime issue condom se be ya omo nya infection na omo ankasa so omo adwuma mpa so omo ye no ometime ato aso aye mra omo nyare anya saade a omo ye adwuma no ayare akoda wawu amra sika mo pa no munye bi nie nti yesra mo a another way to use is not say over here with the condoms back come on. And more worry yes, some control. The Mariana dress come again a crown moment to 2 months. That's all more try it's kissing no more. When you're careful, he said, "Oh, here, no, we don't know, we don't know about Brown. He said, "Yare no fun out of my area. We be crowding when you saw the uncle baby, as not one of the Akakoyan." India someone titu more 77 you say bibi omo nsam waka kese am toto ne mo chichen kwala no someone mo hwem hu yi na ye kan sa no bia na mo akofa yare bia akoma uba o pena sempa ne bia o de akoye no oku ana wo yire no oku no na mfa so bia ma na okora so oku nti no yare ne ade a hia pese wo ba ho ban na mo ma yare no so eye ifiri esasa so near Chato American say, "Oh my quality data, we are it's so surprising." Say, data na modern man for or modern actual people na yakanya you represent san in my brain, and yet detailed data modern man we are not a collective data. Collective data is not a whole lot of confounding factors in it. And you know, some men American paper now. I see your paper and say. It's giving me an idea about the issue, but it doesn't give me the information. I am more informative to correlate them together. Make me the aye a planning be and I say my starting education be amount. Is a woman with data say 15 to 56 and 59. The whole range of population. When I will plan the video command because you remember I said each group be a way or no faswa or and to nya and you know so breaking it down even say teenagers say no munya woman early above teenage no 20s you say no me 34 you say no me no and about boa me yet me say determining factors na e wo amom causes are mass ade no ba we can be able to fish it out until yes some more data no mama nya no yiro sa ma ye we yiro sa no and any impression here on anything that you guys want to present to anybody. And to Miss Ramon, Madam Wasi, someone mamma a brain, na itimashamo, HIV, Nimamam. What time never some fire for nothing, ya pensem, I am known, say, a prime fast one meeting about Bank. Major, my daughter, Boison, Diana, or we pick a credit café.
Yo, doc, that was with there. What can be? I mean, shouldn't be an American say, more money, abroad for customer prevention. Is better than cure. I mean, creative measures no how we are able to withdraw, but so one yare crap with the anke no ye better. yeah, apply a note to such situation. Yeah, never be what. Yeah, yeah, but in actual fact, and she didn't come nipa. A been a dog a kind, no, say a memo mujina kwan one, I say, sex itself, no. My share, Martina Wajia, sabi bema na so ba. So one yet one you'll be under. One woman, tis a ubia, Yabeka say, see na Rebecca so branty, yes, 3 years ni, on your bad into a minty bida. And also be a boy, yes, we did 12, we did 15, we did 20, sabi or no bad and yes, say a tanam, there was nothing like that. Nobody dies from sex. It is something that can be controlled. You bet me one area, so okay, say comedy wound the day, and a different thing. We are fasting 40 days, yes, we are in a comedy, no. Into anon the human a year comedy, but the bit is a sad day, no. Sabi one ya, womb. And it's one of the areas that also brings what of course, we mentioned blood transfusion. It's through no fault of yours. He does so here moja and will be a coordinating moja. Either say free and I see a trainer and a hospital available and a doctor amaya transfuse you. And I don't know when you're and only a different and I know you have no dealing with that. And you know, because if you ask me a one, so obina kind of what so be on kumukwa and one cassa and be. So be enku amfa bo ambo na petu ambo kwa one day no one kasa obewu na wu obewu no e obi ne kun wa na wo inflict hu ana say yare ne kun ana say wunyiya na wu ye Bible say David esum ne maya na ye de no wu ye. That is old age. He served his generation. He just that we don't know what disease killed him, but you just pass away easily without ebekasebia obi ne ku ana say yare kes. Of course yenya yebewu nam kwan so obi ade bekonti. Please nian ube to control over baby say HIV ube to their more please we have control over apart from transmission other but yeah one kasa wonne boy and our kwaya wo kwan ho especially say be some mo je kyan kwan so mo de adwuma me ya ne say one night no nya be ma ba ko de kwa obeto ka ma no be sisi ma please and yeah, good profession. Although it is the oldest profession among humanity, no, it is not the best. It's there. It's been old and a kumunko for still. I say yembua. Inti say yankasa ye prevent it from getting to us. We live older and live older. Inti abstinence a very good thing before you marry. Bible na in track of you. So when I won't me end depoa. In some na Bible with the ball bra a wow and also avoid fornication. Avoid practice abstinence. So one koya will be in farm account and the old wires so yanko palma ba but when so ba the bound. Now when the back and some BBC so oh ajua unkwana me no ho no way the coffee here. Mumbi obianko be there and we don't know it could be no because na BB else. But some nya na mo to obiancha no ho you cannot say so when about because more wires be an test into moon so yenya ba obi negative into yenya negative along the way no then akwa me obey positive ucha ho ana say ukoji moja. We have to watch those things. Those preventions are very important. That is what we've been trying to discuss. We lay emphasis or we focus on the Ghanaian community where it's alleged that this HIV is coming up again because of some practices. We are not saying that it is rampant, but then we try to pick a chronic disease or something that we can discuss to help our people by virtue of our higher education. That is what we can do to, serve our community, to spread and share our knowledge. So I want to thank Dr. Opoku Agyemang for availing himself. I know he works every other weekend, so it's not easy to pull into the studio every weekend. But then when we have time and we meet again, like he said, we'll pick another disease and then the education that we can bring to you, we will. So thank you for joining us. Please go back to Era One, Facebook or YouTube, share the video, let's awareness show, because these days we are in AI generation, artificial intelligence. Everything is possible. Technology is on the rise, so maybe I possible. When I'm hokra, sanobi yakoyo bitine the best body so near so when I was silent, we have to make sure we are abreast with technology. Doc, the RCP say we need a EBA closing remark. I think we'll bring the curtains down and then we'll meet again next time. Thank you very much. All right. All right. Okay. Thank you very much. We'll meet again another time. Have a blessed evening. All right. Bye-bye.
Goodbye.
Bye.
I didn't